Do you have type 2 diabetes? Do you have liver disease too? Do you know? Hi, I'm Donna Denson, the dynamic diabetic, and today I want to talk to you about liver disease and type 2 diabetes. And yes, there is a connection. Studies have shown that there is widespread liver disease among type 2 diabetics. And those liver diseases look like fatty liver disease, advanced fibrosis, cirrhosis, and again, mounting evidence that there is connection to type 2 diabetes. So there are calls for more screening to be done to identify patients and treat them early, reduce their risk of becoming unreversible liver damage. The Endocrine Society, the American Association of Clinical Endocrinologists, and the American Gastroenterology Association and other groups have stepped forward and sounded the warning and the concern over the high prevalence of liver disease in type 2 diabetic patients. It's suggested that we as diabetics ask our GP, our general practitioner, our endocrinologist, our hepatologist, whatever we have, to collaborate together to manage and treat liver disease. NAFLD, which is non-alcoholic fatty liver disease, and NASH, which is non-alcoholic steatohepatitis. 1 in 4 adults in the U.S. have some form of this. So tests show that in type 2 diabetics, NAFLD, non-alcoholic fatty liver disease, is prevalent in 70 to 74% of type 2 diabetics. Fibrosis in 6 to 15%, and cirrhosis in 3 to 8%. Guys, our liver supplies our body with sugar, with glucose. It also stores glucose till we need it, okay? So fatty liver disease becomes very involved and connected that way with type 2 diabetes as well. Over half of type 2 diabetics, like I said, 70 to 74%, have and develop fatty liver disease. So why is that a problem? What's happening? Well, looking at various studies done, including the Mayo Clinic, it looks like our endocrinologists, they don't test for this, and a lot of them aren't even aware of the huge numbers that are involved here. It's just starting to get out into the medical community. We should all get tested, especially if you are obese, if you are older, if you have metabolic syndrome, other complications. You definitely need to be tested. Tests may include a liver scan, ALT ultrasound, or transient elastography. Fibrosis 4, which is a FIB4 scale that they look for to see about that. The goal is to detect these problems early, again, and avoid them being unfixable, of being them unrepairable. Symptoms of liver disease: skin and eyes appearing yellow or jaundice, abnormal abdominal pain and swelling of your legs and ankles, itchy skin. Itchy skin is a big alert. Dark color in your urine, if it's a darker gold, pale stool color, chronic fatigue, even nausea and vomiting. if you have any of those symptoms and you're a type 2 diabetic, then you should truly, the next visit you have, insist that the doctor do a test, whatever he can, to find out. There are blood tests that would show some elevated enzymes in your liver, and the other tests that I mentioned that can be done to find out if you do have liver problems. Because if you find them, then we can help reverse them. They are reversible if they're caught soon enough. Losing weight has become a absolutely major resistance to this disease. You know, even losing a little bit of weight can make a difference on fatty liver disease. I wanted to be sure to come to you today with this information because it's just now really being pushed out there for everybody to become aware. I believe that knowledge is power, and you know I want you to have all the power you can get. So today your power is about your liver. Get it checked and keep it checked. Ideally, you would have a test run when you're first diagnosed with diabetes, and then you would have it checked every year. But we don't live in a perfect world. It hasn't been being done, perhaps in the future. But for now, all of us who are type 2 need to pay attention, to go have our liver checked, ask the questions, get the help, so that we can control this problem. This doesn't have to end up with us in stage 4 liver disease, okay? We can stop it. I hope that you found that informative today, that you can use that knowledge. I hope you will share this video with other diabetics. The word needs to get out. It needs to get out now. So again, share, share, share. Please subscribe to my channel. I try to bring you everything you need to know as a diabetic to keep you healthy. I hope I found you safe today. I hope I found you well. And you know, I always hope I find you happy. This is Donna Denson, the Dynamic Diabetic. Thank you for being here. May God bless and keep you until we connect again. Bye-bye.